Hi, I'm Lauren. I want to talk about Halluxabductovalgus, also known as bunions. Bunions are a multifactorial issue. It can happen due to hereditary reasons. Biomechanical factors are the biggest one, as well as footwear. So footwear, if we're in a confined shoe, that can cause pressure on the toe and predispose this position. It's called Halluxabductovalgus because the big toe abducts away and rotates, and then that can lead to pain and an eminence here. There are soft tissue structures that are imbalanced with this setup, as well as tightness and changes to the ligamentous structures around that joint capsule. So when someone's dealing with this issue, we want to make sure that we are reducing the biomechanical factors that are causing that foot to go into this position, as well as the footwear. Pronation is a big one, and hypermobility is a big one. So if you're hypermobile, we're more likely to have a pronated foot type that can cause dorsiflexion and changes at toe off. And the foot becomes not a rigid lever, so it's not stable for toe off, and we end up toeing off in an unlocked position. So orthotics can help address that, strengthening the tibialis posterior muscle, the calf complex. Abduction, I like people to work on spreading the toes apart, toe spacers, as well as glute strength is very important as well. So that's why I like working with a rehab team, is because I know that if the glute's not firing, then that's going to also impact how the foot is loading. Sometimes there can be also tightness in the calf compartment. So if there's tightness in our lower calf, then that can cause changes of how that foot loads. So when dealing with this, we want to take a look at the individual biomechanical errors. How do we strengthen? Orthotics, proper footwear, wide toe box shoes, focus on strength, toe spacers. And if in instances where there's quite a bit of pain, we can also use topical anti-inflammatories on that area. I typically like diclofenac. And then in stages where people have a lot of pain and it's not responding to conservative care, there's also the surgical interventions that can be done as well. The biggest thing when people get surgery is to make sure that we are addressing the biomechanical errors, because it's not abnormal for it to come back as well. So it's important to, as soon as you're done, when you're in rehab, you're weakening the foot because you're immobilizing the foot for a period of time. It's really important to work on strengthening the kinetic chain to make sure that that issue doesn't